Hello everyone, my name is Richard Koch and I'm here today to talk with you a little about surgical site infections and the nursing interventions and dressing types to hopefully prevent those from happening. Throughout my presentation you may see some misspellings or some questions at the end of each slide. If you're able to point out misspelling or answer a question, you'll be eligible for a candy out of my little grab bag, okay? So going through some of the things, we're going to talk about the prevalence of surgical site infections, the risk factors that are associated with them. Also, review the best methods of surgical dressings and, like I said, nursing interventions to prevent infection. So, all right, the prevalence of surgical site infections. So surgical site infections account for 15% of nosocomial infections. They are the most common nosocomial infection among surgical patients. This statistic is extremely high, and we as nurses have the ability to bring this number down by providing good care for our patients and utilizing the best methods possible with the dressings. So, what are nosocomial infections? So they are basically a hospital-acquired infection that is caused by viral, bacterial, or fungi pathogens. So, continuing with the prevalence, as we can see that they account for 20% of all hospital-acquired infections. That number brings an extremely high cost to the hospital, which you can see there is 3.5 to 10 billion each year. That healthcare facility must eat those costs when they are readmissions back to the hospital. So preventing those infections is also great for the patient as well as the nurses and potential raises that could be impacted by all those readmissions. So what is the estimated annual incidence of hospital-acquired infections? And that number is close to 1.7 million annually. It's pretty high, so anything that we can do to bring that down is going to be beneficial to everyone. So what are some risk factors for surgical site infection? So hygiene is very important. Diabetes is extremely important to be able to manage your diabetes. And then also obesity. So these are good teaching interventions the nurse can do, discussing any issues that the patient has with diabetes and managing it to make sure that their wound heals correctly. And obesity is another one that the nurse can talk with. These are modifiable risk factors, like smoking is another risk factor that can be discussed with the patient to hopefully have some smoking cessation. And that not only will this promote a healthier lifestyle, it'll also prevent a surgical site infection, hopefully. So with that question there, how much more likely are patients with diabetes or obesity to have a surgical site infection? That number is actually close to 3 times more likely. That is a extreme stat there that you could basically tell a patient, and they may want to modify any of those risk factors that they can. So there's some surgical dressings out there. The most common dressing is the standard gauze dressing, usually covered with Tegaderm and changed daily with as needed, depending on saturation. It can be wrapped with an ACE wrap as well. These are a couple of the common dressings that are utilized after surgery. The new one, the one that I'm here to kind of talk with you about, is this silver impregnated big Band-Aid looking type dressing. So this dressing has silver impregnated into it, which provides an antimicrobial environment for the patient, so hopefully a better prevention of a surgical site infection. This dressing can stay on for up to 10 days to 2 weeks, depending on if there's any saturation or anything like that. That would be the only reason it would need to be changed, is if it was heavily saturated. And also, one of the other big benefits of it is the patient can shower in it. That is a great way to reduce surgical site infection because any moisture underneath a dressing and things like that, harbor a good home for bacteria. So they can't go into like a pool or bathtub or anything like that. No submerging it, but water going over it is not going to hurt it, and it actually makes it easier for the patient as well. So go ahead and have that available for you. So some nursing interventions. So one of the most important thing that we've been instilled ever since the first day of nursing school was hand hygiene. This is always going to be the best way to prevent a surgical infection. Having good hand hygiene prevents all types of infections, not just surgical infections. It's healthy for you, it's healthy for the patients, it's healthy for everyone involved. So that's proper hand hygiene is really one of our better ways to prevent like a serious life complications with infections. So we just need to continue doing our due diligence and making sure that we do actually use good hand hygiene. So with that question there, does anyone know how often bad hand hygiene occurs in the hospital setting? This statistic is kind of alarming as well, but it's close to 50% of hospital personnel don't use good hand hygiene. So cutting that number in half will make a possibility of lower surgical site infections. So some teaching, like I discussed earlier, about those modifiable risk factors and what you can teach the patient regarding promoting a healthier lifestyle. Also, signs and symptoms of a surgical site infection, which would be elevated temperature for a long period of time, any pussy red drainage or heat around the incision is a sign of infection. So they need to make sure that they know those signs and symptoms, so that way, if they do have an infection, it can be treated immediately before further complications occur. So it's going to be very important for us to make sure that we teach our patients that and hopefully prevent it. But if we can't prevent it, we can show them signs and symptoms to make it so it doesn't get worse. As far as dressing changes, so the nurse is always going to be ultimately responsible for the dressing changes of whatever the doctor orders. So most doctors, if they use that standard dressing, we'll have to change it daily unless it's saturated and we need to change it more often. So that silver dressing, though, like I said, can stay on for 10 to 14 days. So it makes it easier not only for the nurse, but for the patient as well. And provides that good environment for preventing infection. So there's a lot more to enjoy about those dressings than just preventing infection as well. It's easier for everyone. So that will hopefully be the new standard of dressings in the near future. So with all that in mind, I hope you're able to gather a little information and understanding of these silver impregnated dressings and how they can prevent infection, and most importantly, remembering good hand hygiene and as well as teaching to prevent a surgical site infection. Thank you very much for listening, and I hope you enjoyed the presentation. Thank you.